Right. Hello. Hello. Yes, as we've just been told, this meeting is being recorded, and I'd like to welcome you to another talk from the Leon Levy Dental Library of the University of Pennsylvania School of Dental Medicine. And my name is Laurel Graham. I'm the head of the dental library and hosted this event today. And today I'm more than delighted to speak with Dr. Ann Koch. Dr. Ann L. Koch received both her DMD and certificate in endodontics from the University of Pennsylvania. She is also the founder and past director of the postdoctoral program in endodontics and microsurgery at the Harvard School of Dental Medicine. And following her clinical and academic career, Dr. Koch formed her own successful technology and development company, Real World Endo, of which she was CEO and president. Dr. Koch is also the holder of multiple patents and the author of more than 150 articles in her specialty field. Dr. Koch has also presented more than 1,000 lectures worldwide. In addition to her clinical specialty, Dr. Koch is a strong advocate for professional women and presents at many medical and dental schools. Among her various presentations is The Entrepreneurial Woman Doctor. Additionally, she has gifted a large seminar lecture room called A Place of Our Call Our Own, which I wanted to give you an update on that, Dr. Koch. PDM is actually adding another plaque to designate that space as a safe space for LGBTQA Excellent. Individuals. Yes, and I just learned that this morning at the University of Pennsylvania School of Dental Medicine. Additionally, she has endowed a 5-year program dedicated to diversity inclusion issues at the Harvard School of Dental Medicine. Dr. Koch maintains faculty positions at Penn, the Department of Endodontics, as well as serving as a senior fellow with Penn Medicine. She is also a member of the Board of Advisors for the University of Pennsylvania School of Dental Medicine and maintains adjunct faculty position at Harvard School of Dental Medicine. Dr. Koch is an active member of numerous professional societies and organizations. And on top of all that, she is also the author of It Never Goes Away, Gender Transition at a Mature Age. It's a book chronicling her gender transition. And this reader, meaning myself, found this book both profoundly moving and timely in a world where we have a dire need to understand and empathize with one another. Listening to Dr. Koch's audiobook also made this very personal book even more touching, as the stories were experienced by the narrator. Dr. Koch did not cry when I would have expected her to, but rather exuded an inner strength that was and is truly inspiring. And I really want to give a warm welcome to Dr. Koch. I'm so happy and pleased that she agreed to speak with us today. And I do want to suggest to people that they do get the audiobook, because I believe that it added to the experience of reading this very personal book to actually hear it in her own words. To begin with, Dr. Koch has agreed to accept my first question from Andy Warhol. As I explained to her, I like to intersperse interviews that I give with questions from Dr. Andy Warhol. Where did that come from? Andy Warhol. He used to run the magazine Interview, and he was known for his questions. So this question comes from Andy. It's, Dr. Koch, what did you have for breakfast this morning?
Since I'm right now currently in a hotel in Kansas City, Missouri, I had an egg frittata, a glass of cranberry juice, and a coffee. And this is so meaningful to me because I was telling Laurel, I met Andy Warhol many times because I was in Montauk all the time in the 70s. And Andy Warhol and Paul Morrissey had bought a huge amount of land and houses, Sanford White cottages, and all these luminaries would come out to Montauk by seaplane. So whether it was Halston or Mick Jagger, Peter Beard bought a place, was a very well-known photographer. So that area, that era, and that part of Long Island is an incredibly fond memory for me. So I am thrilled that I'm getting Andy Warhol questions.
Wonderful. Thank you. Well, now we'll move on to a question more central to your book and your life. I'd like to start with this observation question. You have been a successful business owner. You've running Real World Endo, which you can tell us a bit about also, and have practiced dentistry for over 3 decades. You've taught at Harvard and served in the military. In other words, you are a supremely educated and accomplished woman. And yet, as you write in your book, you were afraid to be who you truly are until a cancer diagnosis confronted you with your own mortality. Do you think you would, without the diagnosis of cancer, do you think you would have transitioned? Would you have had the strength to do so?
That's an easy answer for me, and it's going to be a surprising answer, and the answer is no. And the reason is this is not so easy to do. And I was I was very well aware that it was going to be challenging. it's a bit of a concern to me with some of the younger people where it's a little bit of a somewhat cavalier attitude. And especially on the surgical side, where is it body modification or is it, interventional surgery? So for me, at that point, I was able to compartmentalize it. But what is very common with older trans people, there's a trigger event. And what the trigger event many times is the death of a spouse, surviving a car accident, a cancer diagnosis, or surviving cancer. And at that point, mortality hits you. And you just have to flip all the cards. I've got to do this before I pass on. But if that hadn't happened, I'm very confident that I would have just gone along the way I was going along.
And so that has a follow-up question. So since you had the strength to do that, it seems like you've had writing the book, and in addition to endowing the room at Penn Dental for LGBTQA students, how did that come about? What inspired you to do that?
The interesting thing for me was I had obviously treated many trans patients through my career, and I was always aware with that. And I had spent 5 years doing many commercials and modeling in Tokyo, so I was pretty aware of the scene. And I used to spend Sundays in the Penn Library and then at Harvard reading everything I could about gender identity disorder. That's what it used to be known as then. I never want to see another archives of sexual behavior in my life. I've read them all, okay? But when I transitioned, I couldn't believe at that time how many LGBT people I came across in both medical schools and dental schools who were very, very concerned about coming out. And they were concerned about tenure in their own facilities or institution. As graduate students, resident students, they were concerned about, will I get the residency of my choice? Will I get into it? And then I saw bias and prejudice against these people. And I thought, my God, this is like patently wrong. I also realized, for those of you who know me, I have a strong personality. And I think the one thing that has helped me more than anything, I've always had enormous energy. So doing this, I just keep kind of going forward as the ever ready bunny, but I'm doing it in a way, and I was incredibly motivated. And then, and I didn't really share this at the depth I could have for a number of reasons. There were a lot of people who worked against me, who did everything they could to try to make sure that I would fail. That really got my ire up, and I was damned if I was going to let them succeed. And so what that did, that galvanized my commitment to trying to make a change.
So you wanted to support the students at Penn Dental and apparently at Harvard.
And not just students, and faculty members. Mm-hmm. I remember at around, I guess it was 2015, I was going to give a presentation on D&I out at UCSF. And at the time they mentioned that they had the first LGBT faculty member come out the year before. And I said to this person, I said, wait, are we talking about the same San Francisco? I said, look out your window. Is there a big prison in the Bay? Right? That's San Francisco? That was astonishing to me. So for me, who had always lived in the straight world, seeing this kind of hesitancy and bias or perceived bias, I said, wait, this is not right.
Do you think that's unique to dentistry, or do you think it's worse in dentistry?
Yeah, dentistry, as I write in the book, when I had thought about doing this, I had two plans. One was to change gender and then go to medical school, mainly because medical schools and that space is less conservative than dentistry. Dentistry as a whole, and I think it's related to what you're doing, it's a very narrow thing. You're looking at a mouth, generally at a tooth. So dentistry is far more conservative than medicine has been. But one of the interesting things, I had a chance in 2017 to be like a keynote at the ADEA meeting, which was really fabulous. And I'm going to be like a key at this 2021 SmileCon, which is the new name for the ADA meeting. So the people from ADA had approached me at the Yankee about a year and a half ago and asked if I would do a bunch of things. And I, of course, agreed. And then immediately right after that, you know what I said to them? This is exactly what I said to them. What's taking you guys so long? And what it was that there was a personal involvement. So especially on the trans side, which is more challenging for people to get their arms around than, LGB, what happens if there's a personal involvement, a nephew or a niece, that changes the entire conversation.
I do think what we've seen too is the welcoming nature of especially at the dental school. I know I think you spoke about that, feeling very welcomed by the Penn Dental and the
Without doubt, one of the things, and I talk about it in the book, and I had, for the only time in my life, I didn't control the narrative. I played lots of athletics. I was many times captains of this, captain of that, and aggressive sports. And I was so like befuddled, like what was going on. I couldn't believe that there were so many people working against me. I kind of didn't take control of the narrative. If you're transitioning gender, you have to control the narrative. What changed my life, and I talk about it in the book, was that I received an email from Marin Gorn. And she mentioned that, well, we understand that you've changed your name and you no longer live in West Palm Beach. So I realized, oh, I didn't know. And I reached out. And then the next day, I received the most incredible, heartwarming email I have ever received in my life. And that was from Dr. Sing-Kook Kim, who was my mentor. And those of you who don't know Dr. Kim is PhD, DMD, MD. He's a world-renowned endodontic microsurgeon. His email was so heartfelt that had me inspired. I came down and it was like a little unofficial Ann Koch day at the SDM. And that just completely stunned me. And in fact, about 2 years ago, when I first started the What Does Penn Mean to You? I actually wrote a letter to the Gazette, and I talked about what Penn means to me, is that Penn really became my family. I never even heard a response from the Gazette. I thought they were going to say like, well, thanks, but we're not interested. I never even heard anything, but I wrote what I thought was a very heartfelt letter, what Penn meant to me. And what Penn meant to me was Penn was family.
Well, I can speak to Penn Dental, and we definitely feel that towards you, Dr. Koch, and you've been so generous with the school and with myself personally. I can only imagine, I'm not a dentist, but what sort of inspiration you are to dental students and, as you said, faculty and staff.
Right.
So that's a testament to you and your book. And it does lend me to one of my other questions is, after all of this, and if you read the book, you'll learn, how, not only the years before spent wondering and thinking about this and being, troubled, I assume, or going in anguish. I'm putting words in your mouth, so correct me. But through this, being challenged with this transition or thinking about transition, but then the actual physical transition, and then to write a book about it. That's one of my questions, is like, what inspired you to do that? And I suspect it's giving back. But
yes, and the biggest thing to me was, who's looking out for the patient? Because what has happened, it's so easy to game the system in transgender medicine, both gaming the system as a potential patient and as a provider. And then what made this change dramatically, and this was around 2012, 13, that kind of time frame, was that with 1557 of the Affordable Care Act, that increased access with insurance to a lot of the surgical treatments. Generally, when you increase access, that's a wonderful thing. But what happened, they opened the floodgates. And all of a sudden, the hospitals and places realized, oh my God, there's a lot of money to be made here. So my concern was, I think the biggest weakness in transgender medicine is patient selection and on a therapy side. And I think too many people have been green lighted, and I don't think they've been properly diagnosed and given time for things to precipitate out. But what happens in the past, when we've had things like that, the medical community has kind of been the firewall. But now with the amount of money that's coming in, it's crazy. I have endowed a program at the Philadelphia College of Osteopathic Medicine on transgender health issues. And I interviewed a lady, a wonderful lady. She had done 430 procedures in the previous year. I have a good friend who left Indiana. She's in Miami. Her waiting list when she left to come to Florida was more than 1,200 patients. So what's kind of proper therapy are these people, going through? And as I said, it's so easy to game the system because they have websites, and especially with kids, how to get, on hormones easily, that kind of stuff. And it's so difficult weeding out legitimacy from some people who maybe are a little bit confused. And no one wants to say that. Everyone is intimidated by the internet. The docs are intimidated. They don't want to be listed as transphobic or homophobic. And also there's all of a sudden now there's money coming in. And so for me, I think we've gone from here to here too quickly. And I think the sweet spot is here. So what I am, and I don't hear anybody talking about this, I'm not an activist, not anywhere close to being an activist. What I am is an advocate. And what an advocate is very, very different than an activist. An activist is the political agenda overrules everything. It's like a civil war. The individual casualties don't count. It's the theme. If you're a healthcare provider, and that means whether you're a doc, a nurse, a PA, staff member, the most important thing should not be a political agenda or a personal agenda. The most important thing to you is that person sitting in front of you. And that selection process has to be improved in transgender medicine, in my opinion. I've gone all around the country for a number of years, and I've only found one therapist. So I say to them, when do you say no? And they say, oh, no, we never say that. We leave it up to the surgeon. That, of course, is the wrong answer. The surgeon's skills are a different set than the therapist, psychologist, or the psychiatric individual.
So you're fitting a very unique position. I mean, you're patient, and you're also, in some case, you could be treating transgender patients. Because I do mention uniquely for the dentists in the audience, you do discuss dental concerns and
Absolutely.
Yeah. So you have such a unique position. Do you know, has anyone else taken?
No, and one of the other things that is interesting is most trans providers who have transitioned gender, they go back into the LGBT gender non-conforming world, which is fine. I live my life in the mainstream, and I had so much opposition when I came out, and that included one major company that had a fatwa against me, meaning if anybody communicated with me, they would be basically threatened about being fired. And this went on, who was counting me, for 49 months. And I even had gone to a law firm, and I was thinking of suing a couple of companies. And they said, listen, we're going to adjudicate this in Massachusetts. We don't think you're going to lose. I said, I'm not going to lose. Then I had a total epiphany. No, I'm not going to do that, because yeah, I can maybe get a couple of bucks. But what I'm going to do instead, I'm going to reestablish myself in my specialty. So what this is all about is somebody trying to reach their authenticity and then reestablish themselves in their profession. And it's very important for me to have reestablished myself in the mainstream. And what I mean the mainstream is, I have, of course, many, many straight friends. I have many, gay and lesbian friends. I have a couple of trans friends. To me, that's just life. And having lived on Cape Cod in many years, people on Cape Cod don't care if you're straight or gay or bi or trans. The only thing they care on Cape Cod is that you're not a New York Yankees fan. So for me, my space, having this unique prism of having gone through the process, both as a provider, as an experienced healthcare provider, and I've been in dentistry now for almost 50 years. And the second thing, as a patient, I was able to look through two entirely different set of spectacles. Some stuff was exhilarating. Some stuff was not so exhilarating. And that's the thing as we go forward. We have to continually do best practices and always make it patient-based.
Absolutely. And that's really what you get in your book. I felt like I almost wanted to think it was almost like it's like two different books in one, because you have like the textbook about the transition, and then you have your personal experience. And right. It really is an incredible book on the topic. But we do have a question, and I did want to remind our audience that we are accepting questions in the Q&A. This question is for you, Dr. Koch. I am so glad, and this is verbatim, I'm so glad your experience with PDM was a good one. Unfortunately, a few of my fellow students, colleagues have proven themselves less accepting as one would hope for in a healthcare provider. What is your advice in dealing with bigotry in dentistry, both as an ally and as a member of the LGBTQ plus community?
There's a couple of interesting things on this. First of all, it's like, and this is just, I'm just picking a name up, like in the hospitals, Dr. Rosen, is a 50-year experienced endocrinologist who comes into the school a half a day a week, right? And then he says a couple of things that acts a couple of ways. those individuals need to be taken aside and have a conversation. Listen, John or Bert or Bob, you can't do this, and you have to understand that. But when you have younger people who have an attitude, that's an entirely different thing. And one of the things also, I think in some of the schools, there are some people who really, it's not an attitude, they have something much deeper. And for those people, and there's been a way of making change is that you blow everything up, you nuke everything. I don't believe in that. I think the way that you create long-lasting change is working from the inside. And first, what you have to do is you have to have somebody who's going to be able to establish a dialogue. A number of years ago up in Boston, I've done a lot of work and worked with patients at the Fenway through the years. And they were going to first introduce transgender medicine into a very leading famous hospital in Boston. And the first person they were sent over, they were so excited. They said, we have a person from the community, and it was a bearded lady. And obviously, bearded ladies certainly have a right as just as much as you and I to do whatever they want to do. But I said to the guy, I said, wait a second, that's going to be too much. These are people who are trying to get their hands around an issue. That's too much of a step. Why don't we take a step, maybe someone like myself, who they're not so threatened by, and who I can start a dialogue and a conversation. Then after I'm there, then you can bring in another individual, and then you bring in the bearded lady. But sometimes I think you have to understand the other perspective as well. And I found that out for instance, when you transition gender, whether it's male to female, female to male, you're so focused on your own transition. You are blind to the fact that when you transition gender, everybody around you is undergoing a gender transition. Your spouse, your partner, siblings, your work associates. So there's a lot of stuff here to process. And I think the key thing here, everybody in dental schools and medical schools, we all know where we have kind of like an awareness day, a sensitivity day. It's always the same people who show up. The people who need to be there, they're not there. And I think that's where you have to create allies. Sometimes I'm a little disappointed, and that's more than that, in the trans community when they don't understand the role that allies play. Allies can play an enormous role in eliciting change, and especially permanent change. So again, to me, one of the reasons I wrote the book, this entire thing to me is an education issue.
Yeah, absolutely. And I think that you mentioned in your book, you were so vulnerable too, and mentioning things that you would have changed, or things like your relationship with your wife and that in particular. And I think it's different. I mean, you have work relationships, you have, teaching with students, and you're an example in that way. But can you address how that affected those different areas and maybe what you would have done differently?
Yes. First of all, and this is especially for older trans people, and that was who my book was really specifically oriented to, although there's a lot of overlap for young people and also for female to male. When people transition, there's a tendency to really focus on the physical transformation. That is absolutely the easiest part of the transformation. The most difficult part of a gender transformation are relationships and the emotional aspect. I didn't have a problem on the emotional side, and I had very, very little therapy. And I think for most people, therapy is really critical. But I feel I got the physical transformation part down, and I'm very happy with that whole thing. But I got the relationship thing 1,000% wrong. I just had no idea how toxic what I was doing was going to be initially to a number of people. I also thought that they would connect the dots and come to the same assumption that I had. I was completely wrong in that. So when you transition, you have to understand that you're just a small part of a big circle, and you have to control the narrative, how those people in your friend groups get the story that you want them to get, that this is not a frivolous decision. If you're truly gender dysphoric, and this is the problem, is it really gender dysphoria, or is there something else that you're going through? If you're truly gender dysphoric, it gets to the point where it's not a debatable decision. You have to do it. That's why the suicide rate the attempted suicide rate for many years hovers around 41%. because a lot of people don't have the resources to compartmentalize the feelings, and these feelings overwhelm them. For some people, these feelings overwhelm them at age 50. Other people, it's age 15. So it's really, really important that people understand that the emotional relationship aspect of a gender transition is by far and away the most challenging.
And I think that you speak most poignantly about that when you discuss, I think it was you were in a hotel preparing for your facial feminization surgery. Right. And you had no one with you. You had reached out and you had no one accompanying you except for your Frenchie, your stuffed moose. And that really touched me. The way, just that symbolized.
I remember like yesterday, I couldn't believe that all the different things I had done for people. What did I ever do that pissed them off so much that here I am with just this moose? I did give a pair of Ray-Bans to Frenchie. So Frenchie had a pair of Ray-Bans. But the other thing was, not only was it like, net zero, I had people actively working against me. And they were trying to take credit for things that are manipulating financial things. I couldn't believe all this stuff was going on. So
and why? I mean, I could personally understand like closer relationships, people being confused, right. Like your wife and family members, but business associates, I would think that, what would be the agenda? It's so
you get, and again, this is something that's more so on the male side than when female. Women generally are incredibly supportive of trans people, even if they don't quite totally understand why they're supportive. But a lot of guys are competitive. They feel threatened by if I act friendly to you or supportive, they're going to think that I'm this or that. And then other people see it as an advantage. And then, you had a high profile. I'm going to jump right in here. Mm-hmm. And that's, I mentioned, it's like, sharks feeding on a carcass, like on a whale carcass. All of a sudden, everybody's trying to take a bite. I was really kind of stunned and in my own mind a bit underprepared for that. And I thought many times that I have a strong personality, and if somebody doesn't have a strong personality, that could be absolutely devastating.
So I'm interpreting this as they saw this as a weakness in business and they took advantage of it.
1,000%.
Wow. That's
jumped right in.
Wow. Okay. We did have another question as a follow-up to what you were previously speaking about. This is a question verbatim. Would excluding, quote unquote, the bearded lady be problematic in the sense you're removing career-related and personal opportunities from them? And I assume from them means students treating. Is that?
Just repeat that again, because I was a little confused by the question.
Sure. Would excluding the bearded lady be problematic in the sense you're removing career-related and personal opportunities from them?
I'm not, that no one's being excluded. What I'm talking about is the reality of how to work and get change done. It's like the reality of politics. And I know people are adverse to the word being political, and I totally understand that. But one of the things is that people think they're going to come in and they're going to just detonate a bomb and blow everything away. That's not happening. All right. And so what happens sometimes when you have something that is going to have such blowback, you have to go through a little bit more, I feel, in a stepwise fashion. No one's being left out. But the concern for me, especially with the trans thing, in the past, there was such a toxic reaction that everyone's getting cut off. And there's ways of doing this, I believe, in a way that everyone's going to be included. Now, it may take a couple of months, but what's going to happen, ultimately, everyone's going to be in the mix. But sometimes people take it as too much of a onrush, and they just react the opposite way. And again, that's a conversation that goes on all the time. In terms of do we blow everything up, or do we try to elicit change from the inside? And for me, in different social contexts, people may have different opinions, but I can guarantee you the American Medical Association is not going away anytime soon. So there's a way, I think, being smart to work in, not only to get your foot in the door, but have those people who initially had resistance become an ally. And then everybody comes into it. And then sometimes, again, I understand people have a right to be whatever they want, but a lot of people are on a different frequency. And when we're trying to elicit change, I feel you have to understand both perspectives. You have to understand your perspective as a person who's trying to generate change. You have to also understand the people who are in a position of whether it's power or established, that they maybe don't share the same views at this point in time that you do. How can I change that effectively? And as I say in my book, that's my opinion. Right?
Yeah. Well, I think this brings up one of my other questions that I think people outside of dentistry may not be aware of, but is how entrepreneurial dentistry is. And I was wondering if you think your entrepreneurial spirit empowers you to be who you are, and do you think being a solo practitioner, business owner, if it eased or hampered your transition?
No, having the energy to be entrepreneurial absolutely was a tremendous help. And it's not even so much entrepreneurial as it is an attitude and energy. And as I was go along, things that became difficult, instead of taking it as a negative, that galvanized me. That would stimulate me. One of the things that's really interesting to me that I can't believe I really don't get more questions, and I talk about it in the book. My issues in many ways are much more on the women's side than on the trans side, because I've had the unique perspective of sitting at the boardroom table as a successful man and as a successful woman. And it's entirely different. I couldn't believe it. There's this thing where guys will talk right over you or like you're done. Excuse me, tall blonde here, I'm not done. And I never, as a guy, ever took credit for things that a woman did. But I see very often guys take credit for things that women do. And it's not even many times a cognitive process. It's just primacy associated with a Y chromosome. And so women have to be able to stop that when that's going on in the boardroom. And I talk about that when I give my little, entrepreneurial woman doctor thing. I realize it's a little bit easier for me than maybe some other individuals. But I was amazed finding out how women are so worried about being labeled the B word. And that, they only want to be aggressive to a certain point, because if I go past that, I may be labeled the B word. That's everyone's own decision, but you have to find a way that when that tidal wave comes, that you stop it. And I will tell you, when you're in a boardroom, every guy who's at that table looks at every other person and realizes how difficult are they going to be to blow away. And when it comes to the woman sitting at the table, you don't even think about it. And again, it's primacy associated with the Y chromosome. So if you're sitting there and they're ready to just go right past you and dismiss you, you have to find a way as a woman to stop that. I try to use humor, but that's going to be up to everybody. But you just can't let that continue. So I think it's really incredibly interesting to me, the difference from a woman's point of view versus living there and sitting there as a guy.
Has that been a challenge? I mean, I know you said it was a surprise, but has it been a unique challenge to you? Are you alarmed at how much of this you experience that you would have never guessed?
One of the things that's interesting to me is, there's many books from a lesbian perspective that's anti-transgender woman, right? And it's replete. There's a gazillion of them. And I understand that to a certain point, because I know how hard women have had to work to get to the position that they're at. So when I see some guy coming along and, being extreme, like huge breasts and huge garish makeup and 4-inch heels, that's a little bit of a parody. It's not being a woman. It's their own creation. They can be whatever they want. But I can understand some women being offended, because being a woman is a lot more challenging than being a guy. And that's probably one of the more common questions my straight female friends have asked, like, why would you ever want to become a woman? And there's like that, I have an answer for myself, but that is still an answer that I'm kind of befuddled that exists.
There's another question. We have actually 2 questions in the queue. Excellent. Yeah. Hi, Dr. Koch. I'm currently a 3rd-year dental student and also the first trans student in the history of my program. Do you have any words of advice or wisdom on how to navigate transphobia within dentistry and push for positive changes within the profession and dental education?
Absolutely, I do. And the first thing here is be yourself, be natural. Don't be threatening to anybody. I don't. That doesn't matter whether you're trans, cis, or trans. Threatening people is never good. Most people don't like to be threatened. Be confident in yourself. And this is one of the things when I speak to people. There are so many, especially young trans people, and young to me is less than 30 years old, who don't have that confidence. Have the confidence that you're being authentic, and have a conversation and understand that initially that person may not agree with you. That doesn't mean they're worthless or they're terrible. That means they haven't really fully grasped it. And sometimes some people may not. Even people, for whatever reason, whether it's religious or whatever, if you really speak to them, they get to a point where they may not agree with you, but they're accepting and they're tolerating. So what you have to be is, don't worry about being too out there. What you can do is you can interact with people, have a sense of humor. You know, it's amazing. A lot of times when I'm with trans people, this is mainly male to female, one of the things I say to them is, ladies, smile. Smiling is a really disarming thing. And you know, as being a dentist or being a physician, we're lucky with a white coat. We have an ability to touch people, and I don't mean inappropriately, but we can put our hand on somebody's wrist and say to them, this is not going to hurt. This is going to be fine. That's a wonderful privilege that we have being healthcare providers. Smiling and speaking to somebody about what you're doing and why you're doing it and explaining it, I think that has tremendous legs. That goes a long way, because what happens if you speak to somebody, most people I know, and this is so interesting, my professional buddies and associates, my good friends, they took almost 4 years to come back, especially guys. And what happened, one time a guy called me, a Long Island endodontist, and I was so thrilled to have his phone call and to have he and his wife as an allergist, to have Jerry and Diane back in my life. And I said to him, I said, Jerry, I didn't know, there's not a book like, you know, Sex Change for Dummies, and we don't need a book, Sex Change for Dummies, but nobody knew how to react. And what was so interesting is that once this guy reached out, within a week, I had 3 other buddies reach out to me, and probably within a month, 95% of everybody came back. So at this point, did it take my family a while? Yeah, it took my family 3 years. But what happens is that you have to have confidence in your authenticity. You have to have confidence in yourself. Don't blow up. Don't get so frustrated you're screaming and yelling. Sometimes understand their perspective. I think in a professional setting now, it's very different than 10 years ago. If you talk intelligently and explain things, make an effort to understand their viewpoint, but don't compromise your own viewpoint. You're going to succeed.
And I think that was one of my other questions too, was about how you're able to forgive but not forget. Because, and I think one of the ways I titled this talk was about, you know, gender transition, but also life lessons for everyone. And that really touched me personally, because I was thinking, how is she able to, first of all, not hold a grudge and forgive? And you just were speaking so eloquently about that. And I wonder, is that something you gained from this transition, or is that just a trait that you've always had and you used it well in this situation?
I don't think it's a trait that I've always had. One of the things I did realize, if I'm going to accomplish my goal, and for anybody who does this, especially at a certain age, or if you have achieved certain things, anybody on this Zoom conference who's in dental school, you've achieved a tremendous level of success. And you have to have a goal going forward. Sometimes I'm kind of astonished with trans people. They don't have a specific thing. I had a real carrot. And if you remember, my carrot was to be at a Penn alumni meeting and just be seen as another professional woman. That was my carrot. That doesn't mean that's everybody's goal, but that was my goal. And what that able to do, that enabled me to lead my life in a certain way. And I very quickly realized that if I am not able to at least forgive these people for being clueless or being stupid on certain things, it's going to be really difficult. So it wasn't so much out of my nature as it was, this is the smart way of doing this.
Yeah.
All right. And so for me, it was more practicality. than any great feeling on my behalf. Like, is there certain things that I'm still angry about? Yeah, but expressing my anger was not going to hurt them, was going to hurt me. So for me to achieve what I wanted to achieve, I'm going to have to take one for the team and move on and try to make that negative a positive. It's like a bad patient. Sometimes you have patients who are incredibly difficult. Work with them as a provider and have them become a good patient. Then they become an incredibly good patient.
Okay. Excellent. Thank you. We have two more questions. One from a faculty member. I've been teaching for more than a decade the topic of gender identity and sexual orientation here at my dental school in Canada. Pronouns matter. I'm a proud gay man. My question is, how can we be advocates for change within our patients when their provider is transitioning?
Well, it's really interesting when the provider is transitioning and with the patients. I think again, it's respect. It's just like if you're a provider and you have a patient who's transitioning, there are so many primary care docs I speak to, like, what do we do? How do we do it? First of all, just simply ask. So if you're a doc treating a trans patient, ask what pronoun they prefer to be used by. That's not your call as a doctor. That's the patient's call. And I think it's the same thing with patients. If you're a doc and you mention to them, how you prefer to be addressed, could be doctor, could be whatever, and you explain to them what they're doing, that sets the limit. They're not going to be asking you lots of questions about, well, are you going to have this surgery or stuff like that? That's very personal. The thing that the patient generally is going to be most interested in, are you still going to care for me like before? Or are you going to be so self-centered that I become secondary? Anybody who's a provider on the medical side or the dental side, your first requirement is treating that patient the best way it is. Your personal thing is different. And let me give you a great example. 2 years ago, I was a keynote at a kidney dialysis meeting up at Freehold, New Jersey, or down at Freehold, New Jersey, depending where you are. I remember the attendance, 428 people. There were 3 docs, 2 nephrologists, and myself. I was talking on cultural competency. When I got done doing the Annie show, and you've seen that, and I make that fun, I was taking questions, and the final question came from a tall, slender African-American woman who was a nurse. And I couldn't differentiate her accent, whether it was Jamaican or Haitian, but this was her question. She said, Dr. Koch, I'm a nurse, and I'm also a conservative Christian, and there are many nurses like myself who are conservative Christians. Here's my question. Why do we have to treat somebody as a patient when we fundamentally disagree with them? I couldn't believe she asked me that question. So I thanked her for the question, and that gave me a 4-minute opportunity to deliver a soliloquy on what it means to be a healthcare professional. I literally got a standing ovation from 427 other people. But I feel very, very passionate about what it means to be a healthcare provider. And so much of this stuff is having confidence to inform people or to ask people if they're the patient, how would they care to be addressed? That's not your choice as the provider. That's their choice as the patient.
I think that actually was an amazing question, because it does give you an opportunity to broach something that many people in that audience were probably thinking the same. And like you said, one of the things you told me before we started was any question, there's no question off limits. And I think...
And the other thing that's a little bit unique for me is that I know there are many trans people who have seriously traumatic responses if somebody talks about the prior life. I don't. I'm very, very proud of how I lived my life as Ken. So that's another unique thing. It's just like what I said. I look at this from 2 prisms, both as someone who underwent this process and as a provider who saw almost 40,000 patients in my career.
Yeah. Excellent. We have another question.
Fabulous.
Yes, and another thank you.
Coming.
Okay, awesome. Another question. There seems to be a somewhat recent increase of female identifying dental students in the field. How do you think this increase of women in the dental workforce is going to change the field? And I know it has increased, just women matriculating into dental school. And
and obviously there are many schools where it's almost 70%, and it's going to continue to do there's a couple of things. In the dental world as itself, one of the things that people have to be aware of is that there are too many corporate businesses with dentists. When they see women, they think leverage. Okay. And that's got to be stopped, meaning that, well, very often women will only work a couple of days a week. Well, women have babies or this, and they see a woman and right away they think we can leverage this person. That type of thinking has to stop. And that's going to stop as more and more women assume more positions of leadership. The introduction of women in dental schools is quite a bit ahead of medical schools, but where the changes happen in medical schools, especially with osteopathic, the introduction of women has given medicine an opportunity to not be threatened by a One Health concept. What a One Health concept means is that oral health wellness is related to systemic overall wellness. And, I'm very involved with Penn, as I'm very involved with Harvard. And at Harvard, the dental school is part of the medical school. And so for me, I think dentistry actually should be part of primary care. Of course, it's not. But what you have to have the circles come together like the Olympic rings. And that's what we call the interaction of how oral health has ramifications with the overall systemic. The introduction of women into medical schools, especially on the osteopathic side, now on some allopathic, is having medicine take a look at this entire thing entirely different. That's an enormous positive. So, as I say to people, I understand the old white guy thinking. I was an old white guy, right? And so that is starting to change. And what's driving that change in both dental and medical schools is the numbers of women coming not just in as students and residents, but taking administrative faculty positions.
Interesting.
It's been a dramatic change in the last 10 years.
Wonderful. Let me see. I'm going to pull one of my Andy Warhol questions.
Fabulous.
All right. And if you could share more about Andy, I'd love it. Do you keep a diary? And I assume your book was sort of a diary in and of itself.
I'll tell you how I wrote the book. Okay. I at 2 times in my life, I've kept diaries, and I didn't take anything from the diaries and put it into the book. And the way I wrote
number 2, we may have another book coming then.
Yeah. Yes. And if you know me, I've done so many different crazy things. Like you had one of the Warhol questions. What was your first job? As a structural iron worker.
Oh.
Okay. So I have so many things, and there's a book of essays. And when I did the audio book version for my book, I did it at Amazon Studios. And the 3rd day, they thought it was going to take 5.5 days. I was done a little more than 2 days. And they said, we've never had somebody do this so seamlessly. They said, do you do a lot of lecturing? I could have given more than 1,200. And so I don't have a problem talking generally. And so when I did my book, what I did, I would sit in my bed at night and I would speak into a vintage 1979 cassette recorder, right? 30 minutes on each side. And I had to find it on eBay. I would speak for that. I would send it off to a woman. And this was so interesting. She's an African-American woman in York, Pennsylvania. She would translate it, and then she would put it into a document back to me, and then I would rewrite that chapter. So every chapter was an hour, and then I would rewrite it. Well, it was so funny. One point, Tuesday said to me, she said, Andy, she said, do you mind if I share this with my friends? I said, you can share it with anybody. So then suddenly I had this big following among the African-American community in York, Pennsylvania. That was so cool, right? So for me, I like first verbalizing, having it transcribed, and then I go back and then I rewrite it. So that's how I did the book.
Interesting. And I don't think we talked about, well, we didn't talk about much about, when I know you talked about being a child and your mother's dresses and that first experience. And I think that's important if you can give us a synopsis.
Yeah, one of the things is as politics have moved, gender dysphoria for many years was a medical condition. Now it's becoming more of a civil rights thing. I'm a medical person. Most people on this thing are a medical person. The vast majority of times with, gender dysphoria, male to female, there was some kind of a bit of a sexual bang for a while. Obviously, if that continues at a certain level, that could very well end up being somebody who's a transvestite. But in the beginning, everybody I know, and the really experienced therapists, they can't say this anymore. They say the same thing. There is a little bit of an excitement about that in the beginning. But for me, the whole thing that was so amazing was that I had this incredible dichotomy. as I mentioned, I had been skipped a year in school. So as a sophomore in high school, I was 14 years old. And I was the youngest starting varsity football player in all of Long Island at 14 years old. And it's so funny because many boys 13 to 14 at home underneath the bed have a lot of magazines. And the magazines are like Penthouse or Playboy, those kind of magazines. I had a bunch of magazines under my bed, but they were all Vogue. And I used to be up in my room at night designing dresses. And think about the dichotomy. Here's this other person, doing really well in school and is this athlete, great athlete. Then at night, this person's designing dresses. That's a lot to handle. And certainly in 1964, people couldn't say like, gee, mom and dad, I really feel like a girl or a woman. You couldn't say that. So the one thing that I'm very thankful for was that I had the ability to compartmentalize things. And the reason I said that it never goes away, if you're truly gender dysphoric, it never goes away. What happens is that in my case, and I think in the vast majority of other male to female people, if you have a vaginoplasty, the feeling of wanting to be a woman, that does go away. But that is almost immediately replaced by a second feeling. And that feeling is, oh my gosh, did I make the world's biggest mistake? That's never going away. And so what you just have to be able to do is you have to be able to handle that and move on.
Yeah, I think that lends itself like to all of your coping and your evolving. I think that's why I really did talk about being a life lesson. And how do you see yourself changing every day? I mean, what have you learning from this experience?
One of the things I have been disappointed with the trans community is become more and more narrow-minded in the thinking. And what I mean by that is they want acceptance, but they're not necessarily accepting of people who trans and then leave a heterosexual lifestyle, right? So, I mean, when I did this, and for many years, VO changing gender, the idea I thought was like live your life as a woman. That's why I'm doing it. Now with the gender non-conforming and non-binary, there's an enormous wave of that, just like there's been an enormous increase in female to male transgender men. Everybody's story is different. That's the thing people have to understand and respect. I went to college in the 60s and, people had a different point of view. Someone could try to defend Nixon's Cambodian policy. You might have thought he was a total ass, but you gave him a chance and you respected the person for at least doing that. Sometimes because of social media, people feel so threatened that it's getting more and more narrow. There is an association called the World Professional Association for Transgender Health, WPATH. For many years, that was a psychiatric, group, and that was the goal of that. I find it more now political, and I have no interest in. I said right in the preface of my book, I'm not interested in any political agenda. I don't care about the far right or the far left. I'm not interested in their agenda, nor am I interested in anyone's personal agenda. What I'm interested in is veracity, the truth. Everyone's transition is different, okay? Everyone's story is different. So as a provider, your focus should be on the individual. And in the trans world, people working with LGBT people, their things, just like anybody else, that discussion should be about that individual. What's best for that person?
And do you have a hard time navigating that world between because you said it is very political, but you, as a physician, as a dentist, as a doctor, it's like you have to walk this fine line. Like you said, I have to treat, who comes in the door, and even
I've never had a problem doing that. In terms of the politics, I let everybody know, including this is my opinion. And I certainly respect the fact that people have other opinions. And I'll give you an example. For me, having vagina was totally key to my feeling as a woman. That completed me as a woman. I respect other people who do not have bottom surgery. 98% of transgender men do not have anything done below the waist for a whole bunch of reasons. There are transgender women who have they keep the male genitalia below the waist. I respect that. That's their decision. But for me, what completed me as a woman was having a functioning vagina. What I do with it and with whom, that's my own personal business. But for me, and again, this is just my personal decision, that completed me as a woman.
Excellent. Well, we have a political question, but I think it's one we can answer. I think it's very timely. And maybe you'll be, who knows, maybe Biden will call upon you. Do you have any advice for the incoming Biden administration to improve trans medicine or dentistry in the U.S.?
Yes. The reason, one of the reasons in the book was, in addition, who's looking out for the president. I mentioned it, unlike some other well-known trans people who had ghostwriters, one I know at Penn, I wrote my book, and it's professionally edited, which I think is really good. And the last paragraph starts in the book as "no one is disposable." That was one part that I was really gearing that towards young trans women of color, Black and brown people. And that sometimes you can't just be supportive. You have to give them a way of getting out of that rut. This thing about, well, you'll be a sex worker on 10th Avenue, that's fine. I'm not coming from a moral or religious position. It's not fine. The life expectancy is 27 years old. These people have to be helped in a way, getting sober, get some kind of job. The unemployment things are challenging. Help them establish a life that's going to be, bountiful and productive for themselves. Now, having said that, I've kind of forgot what the question was again, real quickly.
It's about trans health, but the new administration,
Biden, yes.
The Biden administration.
Right. What you have to do is you have to work with people to establish transgender medicine as a legitimate part of the medical school curriculum. This thing is going to be internet driven, and understand how I feel about that. I say to people now, the most destructive force I have seen in my lifetime is not the plutonium bomb. It's social media. What's going on with young trans people, it's terrible what's going on. And something that can be so wonderful and so informative can be used and be so destructive. So instead of having people directing and kind of really influencing transgender medicine who know nothing about medicine, what has to be done here to basically complement that, medical schools have to establish legitimate guidelines and departments where you're treating transgender medicine. A number of schools have started transgender medicine and surgical centers, but a lot of them are very much driven by this is a huge cash cow. Wait a second, I'm not talking about a huge cash cow for this hospital or that hospital. I'm talking about having educated healthcare providers and how to work with this segment of the population. That's the key thing. So the goal for me, dental school is different in the sense that a class 3 resident is a class 3 resident. But when you get into the medical school complex, this continuum of treating people on the LGBT spectrum is much more dramatic. So I want to see, and we are starting to see, transgender medicine become a legitimate part of the medical school curriculum.
Awesome. And as we're concluding with this talk, I have one more Andy Warhol question. I think we can tie it in. And his question would be, do you dream? And I would say, what do you dream of?
It's kind of funny. I think one of the interesting things with dream, I do dream. And I think we ask somebody like yourself, do you see yourself in a dream as a guy or as a woman? I'm kind of surprised that people don't ask that more commonly. It took a couple of years before in dreams I was Anne. So in the beginning, when I would dream, it was my prior kind of persona. Now I feel good about that. Trust me. That when I dream of Anne. But I also dream. Sometimes there's seems to be some color. Other times it's kind of black and white. So I don't know whether that's reflective of kind of having, seeing both sides, or whether that's how it is normally for people. But I do dream, yes.
And do you have any wishes for the future? 2020 was so.
Yeah, what I did that. Yeah, what I want to do is I want people in transgender medicine to be professional, and I want people to support people, but not blind support. What I'm seeing too much are too many people getting green lighted, what I call feeder therapists. This happens especially with a lot of kids. And I want to see the differentiation process. I understand the fear about gatekeepers. I'm not talking about gatekeepers. I'm talking about being thorough. And I would like to see more trans people in the media who are regular, average people. The school teacher, the physician, the attorney, instead of like everybody from their own Bravo TV show or their own, Netflix special. That's a very small section of the trans population.
Mhm.
Most of the trans population wants to go on and live their life and be productive. And I'd like to just see some more real world type of role models.
Well, that's a great, I think we can all agree to, it's a great aspiration. And I hope that, I think that your book will further that. And I think you have another book in you. I'm just suggesting. If you do, I'd love to read it. But thank you so much for agreeing to speak to
Thank
us
you for
today.
everybody during the lunchtime, tuning in. I greatly, greatly appreciate it. It's not so much the interest about me, it's about the interest about the topic, and that's far more important. So I'm very, very grateful and thank you so much.
Thank you. And you are getting thanks in the chat. I don't know if you can see that. And someone said, what a wonderful and inspiring talk. So yes, I agree, definitely. And this is being recorded, as we know. So we will share this with many different people. So it's going to go far and wide. Once again, have a great holiday season.
And I'm always available, Laura, to come down sometime, do a coffee thing or anything like that with Penn staff, residents, faculty, make it rock and roll. Okay.
Oh, awesome. Yes. And multiple thank yous are coming in. I see 11. So just so you know, you've done a great job today, and thanks again. So
everybody stay safe, happy holidays, and be well.
You too. Bye-bye.
Thank you so much. Yep.